Professor at UCL, University College London, also Global Lead for Gender Equity at the International Pharmaceutical Federation, and Founder and Chief Operating Officer for Seha Health and Wellness based in Pakistan. FIP's vision is a world where everyone benefits from access to safe, effective, quality, and affordable medicines and health technologies. Our mission is to support global health by enabling the advancement of pharmaceutical practice, sciences, and education. Yesterday, we just marked the 900th day since the World Health Organization declared COVID-19 as a pandemic on 30th of January 2020. We thank you, our colleagues around the world, for providing the best pharmaceutical care as this pandemic continues. We are continuing our work to support our profession in our Global Pharmacies Pandemic Preparedness, the Response and the Recovery Project. Throughout 2021 and 2022, we conducted a survey to better understand the pandemic outputs and responses of our members. We are currently in the process of compiling and analyzing this data in order to showcase global best practices and shared lessons. Our aim is to compile our profession's global response to the pandemic so that we can all learn from each other and use these learnings to inform future pandemic preparedness, the response and recovery. Our findings will be added to the FIP dashboard, which you can access on our sustainability microsite. We are planning to describe this result in a report describing FIP's and our members' responses to COVID-19, which will be launching in October 2022 on day 1000. Stay tuned in our future communication on this. So today we're very pleased to be delivering this event. It's episode number 5 of a series of 7 events of our COVID-19 program. How has COVID-19 changed us? Pharmacy and the pharmaceutical science perspective. Pharmacists and the pharmaceutical scientists have an important role to play in the continued response to COVID-19, as well as preparing for future pandemics. FIP is delivering a digital event program. How has COVID-19 changed us? Pharmacy and pharmaceutical science perspectives. The program is composed of 7 episodes that will focus on therapeutic advances and the change and developments across practice, science, workforce, education, and policy. Preparing for the future pandemics will also be a key focus. This special webinar program of events is being delivered from April right through to December 2022. And today will be the 5th digital event of the COVID-19 program. The aim of this program is to describe current and future pharmacy practice in delivering person-centered care during the fight against COVID-19 and the possible future pandemics. Please note that this event will be recorded, live streamed also on FIP YouTube, and it will also be available at www.events.fip.org. So to all of those listening, please feel free to send your questions through the Q&A box, and we will be picking those up throughout today's session. I'm now pleased to be introducing our panelists. We have Dr. Abby Kahale, who is a PhD, MS, BPharm, MPH, FAACP, and she is a tenured Associate Professor for Clinical and Administrative Sciences and Board of Trustees faculty at the Roosevelt University in the USA. We also have Dr. Suzette Costa, who is PharmD, MPH, and PhD, who's an Executive Director and Senior Research Director at the Institute for Evidence-Based Health, based in Portugal. I'm also pleased to introduce Dr. Michael Gagnon, who is the Senior Director for Pharmacy Practice and Quality at ASHP in the US. And finally, we have Mr. Shepard Masaba, who is the Drug Information Pharmacist and Research Assistant at Drug and Toxicology Information Services in Zimbabwe. So very, very warm welcome to you. So let's start then with our first speaker. Dr. Abby Kahale. She has devoted her academic career to pharmacy and public health education. She earned a PhD in pharmacy from the Department of Social and Administrative Sciences at the College of Pharmacy at the University of Michigan. She also obtained an MPH in Management and Policy from the School of Public Health at the University U of M. And she obtained an MS from the Division of Pharmacy and Healthcare Administration at the University of Toledo after completing her BS in pharmacy. She completed certifications at the APHA. Specifically, she completed Advanced Motivational Interviewing, OTC Advisory, Advancing Patient Self-Care, Pharmaceutical Care for Patients with Diabetes, Lipid Management Program, Pharmacist Provided Immunization Program, and delivering MTM in the community. She is the immediate past chair of the AACP, Global Pharmacy Education, SIG, and served on the editorial advisory board for the FIP Pharmacy Education Journal, and was selected as a global lead for quality assurance for the pharmacy of pharmacy education at FIP. So a very warm welcome to you, Dr. Abby. I'll hand it over to you. Thank you.
Thank you so much, Dr. Bukhari, for this kind introduction, and welcome everyone. It's a pleasure to be here with you today. I'm going to chat with you and go over our objectives. So specifically, I'll be covering strategies and effective policies for developing pharmacy practice during the COVID-19 era. And in the next slide, I'm going to walk you through some of the impact of the social determinants of health, specifically on pharmacy practice. So a recent research that we conducted under the Research in Public Health with my student, we found, as well as with my colleagues, that the COVID-19 impacted vulnerable populations the most. And specifically, there were issues related to ethnic racial backgrounds that made them at a higher rate of being actually infected with COVID. They also suffered a higher level of severity of the disease and consequences and outcome that led them to be in the hospitals, and unfortunately, a higher level of death. So I'm going to share with you in the next slide to show you that these social determinants of health, we are realizing under COVID that they impacted the outcome. So we must address them to make sure that the outcome are the desired outcome that we want to reach when we are addressing COVID-19. In addition to what I shared with you, we have socioeconomic status that include also the education level, the geographic location of this population, as well as what quality of healthcare they've been receiving. And we also found out that some of these patients may not be able to actually transfer themselves to these facilities. So within the next slide, I will cover that we do have, as a pharmacist, a role to play. And please remember, when we're doing education, we can take advantage of education on the internet. In this case, we've had a lot of misinformation. One of my students in Research in Public Health presented at the AASHP meeting, and we specifically targeted the impact of social media. There were quite a bit of information that are misleading, and we needed to correct this information by addressing them with the fact, rather than having the patient relying on the myth regarding the COVID-19 vaccines. Pharmacists specifically can play a role in addition to being an educator. They can actually help with administering the vaccine, as we saw they did globally. And they also can test at the point of care because of their convenient location. They can prescribe, and I'm pleased to say that pharmacists under the FDA in the United States be recognized, so now they can actually prescribe the treatment. And as we all know, they are ranked highly globally as one of the most trustworthy healthcare professionals in their communities and in their practices. In the next slide, I will share with you a role that pharmacists can play. And this particular role, it could be being a health coaches. So after they're diagnosed, the next healthcare professionals will be interacting with patients the most are the pharmacists. They can certainly take the lead on these well-being and wellness programs. They can educate not only the patient, but also their family and caregivers. They can collaborate and educate other healthcare professionals how to best address these challenges in a public health emergency, and using frameworks that would be effective that I'm going to share with you in the next slide. So the first one, the health belief model. I recently published an article with my colleague in the Journal for the American Association of Pharmacy. We took the health belief model and we mapped actually the initiatives to these constructs. So what does that model entail? Well, the health belief model walks through several constructs. And the way to look at it is from the patient perspective. I listed them for you here. The perceived susceptibility, we'll talk about how likely from that patient perspective, he or she or they suspect that they will get that infection. The next question will be, how severe potentially, if they get infected with a disease, how severe this disease is going to be, what kind of symptoms they're going to experience, as well as if they take this action and get the vaccine, what are some of the potential benefits? Are there any barriers associated with that? And we know with the vaccine, it's been made most of the time available at the industrialized countries at no cost. However, that may not be the case across the world where countries that have low or middle income. And then all these factors will increase the self-efficacy. So the patient may think I could actually take an active role in my prevention and maintaining my health by getting the vaccine. In the column in the middle, I showed you how to apply this model. Now we can certainly think of a way to apply it not only for COVID-19, but also for future pandemics, or even a small event that we would talk about the flu, for instance. So you always want to be able to ask the patients what kind of information they have and try to listen actively to what they're sharing with you, and also be able to correct any misinformation they may have. So example, if a patient tell you, I'm not really concerned about the COVID, I understand it's just going to be like the flu. Well, we know that's not the case. We want to address that by explaining to them what are the consequences, especially for those who could be immunodeficient patients. And we also want to highlight the balance between risk and benefit and show them that because pharmacists are able to educate them, they can share with them what are the potential benefits for the long term, not just the short term. We can increase their self-efficacy by addressing any questions that the patient may have, and especially information that could be misleading available on the internet. In the next slide, I'd like to share with you a technique. This technique was developed to specifically address patients that might be more challenging than the typical patient you may have. So we have several principles that I shared with you on the first column on the left side. We start with roll with the resistance. So when you have the patient disagreeing, and rather than debate them, you want to stay away from that argument and make sure that you show them empathy. You show them that you understand where they're coming from. And the next step would be for you to show them discrepancy between where they are, where they want to be. So let's think of best practices and lessons learned for the actually COVID-19. We know, unfortunately, those who couldn't get the vaccine, they were unable to be with their family, with their loved one. They were unable to travel. They were unable to go back to their daily life and active life, right? So we want to distinguish between where they are currently and where they could be after the vaccine. We also want to show them that we understand where this potentially resistance might be coming from, and try to listen to them actively and then reflect when they make some comment to us. We want to make sure that we ask them open-ended questions. So I showed you the application in the middle column, and then on the column on the right, showed you some example for how would you ask open-ended questions. So potentially, what are some of the concerns that you may have? When was the last time that you visited your healthcare providers? Did you already receive any of the vaccination? And how can I help clarify some of the benefit for these vaccines? And then you want to make sure that you listen to them and show them that you did listen to them and hear what they say by summarizing, to make sure that you are both on the same side, and recap this conversation before the patients leave your facility. On the next slide, I will share with you a model that was successful, the transhierarchical model, or the stages of change model. And we published actually a chapter on this model in the American Pharmacists Association book. On the first column, we're going to describe to you what are some of the stages within this model. So the first stage is basically the patient in the pre-contemplation, and a simple way to say that they haven't really intended to change any of their behavior. So if a patient show up and make it very clear that they're not interested in getting either the treatment or the vaccine, the best plan will be to raise their awareness from the application side, to show them that here are some potential information for you and potential benefit, and to reach out to you if they have any more questions. The second stage, which is the contemplation stage, in this level, the patient are actually intending, but not immediately, to get the vaccine. So they may say, well, I'm not quite ready yet, but I'm thinking within the next few months, I might be actually reaching out and getting the vaccine. So here, the plan will be to show them where the vaccines are available, what type of vaccine are available, and which one will be best fit for their age group and demographics. If there are any issues with immunodeficiency, or if they are vulnerable population, you want to clarify to them what will be the best plan. Preparation, you want to maybe reach out to them either via phone or on the internet. Have a conversation with them at least a few weeks or a month before they take that action. And once they take the action, you want to make sure that they maintain. So a lot of education currently we need to do is the fact that why do we need the booster? Well, fortunately, the virus been actually evolving, as you can tell, and it changes. We have variants, we have subvariants. Some of these subvariants may increase the cases because they're very effective in being transmissible. So we want to make sure we address that by saying now it's time to get the booster to increase your immunity to a level where you will actually be 90+% able to defeat this virus. And then once you have your patient on that right path, then you will also look forward to having them continue with this healthy behavior moving forward. Now, this model that I shared with you, it works also very effectively if you happen to have patients who are smokers. So as we know, with the impact on for the COVID on specifically the lungs, the higher risk will be your patient who are smoking, right? So you could use the same model to apply it, and I use the column in the middle, to address any of these health behavior needs, including smoking cessation. And the last column that I showed you is example of what you could do to help your patient put together a plan, give them a tool to make sure that they are not relapsing. However, if they are relapsing, we want to show them what they can do about that, rather than feel that they cannot go back to their healthy status after they relapse and had accidents. You also want to ask them what are some of the potential triggers. So are they surrounded by a support system that are improving their new healthy lifestyle, or is the opposite? So they want to make sure that they are surrounding themselves with people who are supporting these health behavior initiatives that they are taking. On the next slide, I will share with you a list of references, and I will also have an opportunity at the end to address any questions that you may have. The advantage of having FIP resources that they will be available to you to listen to them. If you are able to address any of these references by reading more, I think that would be helpful. So I appreciate being here, and I'm gonna have you join us in the Q&A, and then I'll pass it to Dr. Nadia to walk us through our next speaker. Thank you very much.
Thank you so much, Dr. Kahale, and thank you for your valuable insights on how the health belief model is being applied in COVID-19 and how we can then sort of extrapolate this information and use this information for future pandemics. I absolutely agree with you that motivational interviewing is most definitely an art. And thank you for sharing the lessons that have been learnt from COVID-19 and vaccine hesitancy by using the stages of change. I found that extremely interesting. So thank you so much. I'd like to now introduce our next speaker, Dr. Suzette Costa. Suzette Costa is a pharmacist. She's a master's in public health and PhD in public health, health economics. Her skills and experience are a hybrid mix combining hands-on research, leadership, policy affairs, and business development over 20 plus years at national and international level. She started as professional secretary, then deputy secretary general of the Portuguese Pharmaceutical Society. She was director of the pharmacy-based services department of the Portuguese National Association of Pharmacies, and for 9 years responsible for most patient care services in place today in Portuguese pharmacies. She was executive director of the Center of Health Evaluation and Research for 10 years, and under her responsibility, she has developed policy, remuneration, and pharmacy practice research studies that contributed to relevant legislation for changes in pharmacy. Dr. Suzette has also been the lead and principal investigator of US Pharmacia, a collaborative care project, leading the first real-world trial between pharmacies and primary care with data exchange between IT systems in Portugal. She worked at the WHO European headquarters and served on the executive committee of the European Forum of Pharmaceutical Associations and WHO Europe. She represented Portugal at the Economics Working Group of the Pharmaceutical Group of the European Union and was invited member of the FIP Working Group for the International Assessment of Pharmacy Remuneration Models. My goodness, that was a mouthful. Since September 2019, she is Executive Director and Senior Research Director at the Institute for Evidence-Based Health and is an invited assistant professor. She co-owns 2 pharmacies and a family business with a non-executive role in clinical services and research strategy. Wow, that's so, I love, even with our previous speaker as well, I love seeing women in leadership positions and women excelling within their careers. This is just absolutely amazing. So a very warm welcome to you, Dr. Suzette Costa. I'm going to hand over the floor to you.
Thank you so much for such a lovely introduction, Dr. Nadia. And it is a real pleasure for me to be here today, although in virtual, with all our fellow colleagues around the world, and especially, of course, with our wonderful panel speakers. And I do thank FIP for this kind invitation. So I'm going to walk you through some brief findings of a recent research study that our research team at EASB, in collaboration with researchers also from CEPHAR and from other institutions such as the London School of Economics, University of Bocconi School of Management, and the University of Huddersfield. So we conducted this research for the pharmaceutical group of the European Union in 2020. So this was in the middle of the pandemics, and so I'm quite excited to share some of this with you. If we can move on, please. Okay, the research objectives of this study was basically, we had 2 arms of the study. One was centered on understanding pharmacy-based services being provided in European pharmacies. And the other, let's call it the other bit of this study, was highly focused on the interventions on COVID-19. Initially, this was not meant to be, but because this was about to start and the pandemics was just had just been in place very recently, we were asked to look at the interventions on COVID-19. So if we can move to the next slide, please. Our purpose with this study was first two things: to look and map the current reported practice and trends occurring in pharmacies in 32 European countries. And then, of course, to also perform a scoping review of evidence to see if there were already any studies being published, conducted in pharmacies. We were aware, of course, that the scoping review would not result in too many studies because this was in 2020 again, but we updated later. And the mapping of the 32 member countries, because we knew at that time there were many reports from pharmacy associations on the activities being performed in Europe. So we conducted this survey and we mapped, first we identified around 30 interventions, and they were grouped according to the classification for on the steps for public health emergencies response. So basically we try to organize these interventions under the normal categories used in public health for and well known for those of us who work in this area, the steps that are usually followed in response to any public health emergency. So prevention, preparedness, response, and recovery. Okay, then if we can move on. Okay, so I'll go directly to the findings for the sake of time. And here we will share with you the key findings of the survey conducted in these countries in our pharmacy organizations. Basically, what I wanted to share with you here is this, the most common pharmacy measures and interventions in place in all 32 European countries are marked in red in this slide. So you can see that mostly they have to do with the first steps in prevention, which is, of course, patient information and education, which is queue management in pharmacies, floor marking inside the pharmacy, and barriers at counters. Those were the first to be developed, and they were in place in almost every pharmacy in all 32 European countries. Then the second tier of interventions was in place in between 26 to 31 countries out of 32. So it was again a group of interventions. It's marked in yellow in your slide. And you can see these included protocols for disinfection, use of disposable masks by the staff and basically by everyone, stock and supply of hand sanitizers, and of course, a symptom-based referral pathway. I think it's in the next slide. So if we can advance the next slide, please. Okay, symptom-based referral, increased demand and changes to home delivery in yellow. And then, of course, reestablishing patient care services. So this was actually performed in the vast majority of countries, in more than 80% of pharmacies, as reported by Pharmacy National Organization. So if we can go back to the previous slide, please. Thank you. The third tier was in place in between 14 to 25 countries. So, and this included, it's marked in green. So it included the stock and supply of essential medicines. And if we can advance again the slide, okay. So dealing with shortages and preparing alcohol-banned sanitizer formulations, And one very important intervention, which was the pharmacy telephone support to vulnerable patients during isolation and lockdown, because there were cases of reported domestic abuse, and pharmacies played an important role, not only in these individuals, but also in older people, in people with mental issues. And this was a very important intervention in place. Then the next tier was in place in 6 to 13 countries. It's marked in blue. Of course, the business continuity plan, if most of you who are community pharmacists will know that we had in 2020 and for the most part in 2021, we had mirror teams. So we had to work with these independent mirror teams for frontline, first and second line staff. And besides this, in the next slide, we can see that we had also interventions such as limits on quantities dispensed, increased demands and changes to repeat dispensing, emergency supply of medicines without prescription, and supply of medicines usually supplied in the hospital setting, and hotline numbers for home delivery of medicines, and of course, a protocol for pharmacies for reporting on domestic violence during the lockdown and isolation. So we had all these things in place. And in this particular tier, we included extended powers or legislation that was passed for, especially for point of care antigen testing in pharmacies, which is the black box up there. So this was in place for 10 countries, of which 7 were remunerating pharmacies through governments or national and local health payers. And 3 had this service co-paid by citizens in their own countries. More recently, we then had 8 countries with extended powers or legislation passed for COVID-19 vaccination in community pharmacies or by community pharmacists, which were very important steps and very relevant steps, I might say, for activities and in place and provided by pharmacies, and in a very short time frame. This was a rapid response of a network of pharmacies in most countries, which clearly showed the power of such networks in place to provide rapid access to medication and other patient care, very relevant services. So in total, 18 interventions had expanded powers granted to pharmacists in 17 countries. 22 countries passed legislation in view of COVID-19 for 24 interventions. And in total, 17 of these interventions on COVID-19 were remunerated by governments or healthcare payers in 29 countries. We also had reports of emergency temporary closures of pharmacies due to problems also in their staff of COVID, and some other issues also reported by pharmacists. So this sums up very quickly, because we did not have time to go into details, but I think it gives a pretty good picture of what happened in 2020 in our pharmacies, and of course with the data on antigen test and COVID-19 vaccination that we updated in June 21, just before submitting the paper for publication. So if we can move on to the next slide, please. We also did the scoping review, but as expected, of course, we did not find too many studies, because not many studies were able to be performed in pharmacies during that time. And in these kind of situations, practice oftentimes precedes research. So we found 9 primary studies in 7 countries until April 21. one literature review, 7 cross-sectional studies, and then 1 descriptive paper from FIP, which is also important that our pharmacy organizations are also have made an effort themselves to report on the efforts of pharmacists throughout the world. And we also mapped the resources for pharmacists. So important to say that from the very start, many national pharmacy associations did have resources in place to support their community pharmacists. And then later on, FIP, the World Pharmacy Council, the Pharmaceutical Group of the European Union also developed their own hubs, in part fed by these national pharmacy associations, but they also learned with each other, and which is the beauty of being in an international organization. So if we can then move on to the next slide. Thank you. So as a wrap up, we have a huge and very diverse array of pharmacy interventions and measures on COVID-19 that were provided in 32 European countries within a very short time frame. And you can see they all span across the 4 major steps in response to public health emergencies. There was a clear focus on preventive measures and dealing with misinformation, something we often probably do not give enough credit, but there is an important role played by community pharmacies, and also preparedness focused on stock and supply. And then important, this is hugely important, it was massive, important patient care interventions, which included, again, screening using antigen and in some cases also PCR. And of course, the home delivery. And there was a massive response because primary care services in some countries were clearly affected, and some of the chronic disease patients for a very long time, the only place available, the only health unit available was the pharmacy. We've also seen the expanded powers in legislation, which was a huge and important conquest achieved by pharmacies, and of course pharmacy associations played a very important role, national, European and international. And the next slide to finish. Okay, so I will leave these for the Q&A, but it's just some thoughts that we can think for the future. So in view of all these, which was the wonderful response from community pharmacy all over the world, what we can expect to improve in the future. So in terms of research, of course, it is hard to conduct research in pharmacy during times of crisis and public health emergencies, because it is just not their focus. They are not worried in collecting data. They're worried in getting response to their patients in times of crisis. So collecting patient level data is difficult, but can be improved if we could use, for instance, patient diaries, to use the information on dispensing software and patient-reported outcomes, and partnering with pharmacy associations. In terms of policy, there is certainly a role for reflecting the involvement of pharmacy in future country contingency and emergency plans. So pharmacy has to sit at the table when preparing in advance these national contingency and emergency plans. And then, of course, for practitioners and especially leaders at the pharmacy associations, we have identified key interventions that are vital for the healthcare system, where pharmacists can fill in the gap and certainly have and continue the expanded roles they were given to during the pandemic. Access to essential medicines, emergency supply, medication supplied in hospital, antigen test, referral pathways, and vaccination. some of the things, and I'll leave it for Q&A. And finally, to thank the PGU, the Pharmaceutical Group of the European Union, and the National Association of Pharmacies in Portugal for the grant, unrestricted grant for conducting this study, and of course all at the PGU that have helped us developing and conducting the research in 32 countries. Thank you so much.
Thank you so much, Dr. Suzette. That was so insightful to have an overview of sort of pharmacy-based interventions of COVID-19, and also for sharing your study and the mapping and scoping exercise on the pharmacy activities across Europe. We know that pharmacists and their teams have shown extreme leadership during the pandemic. When everything else was closed, your pharmacist was there and their teams were there available. And it was interesting to see your findings as well from your study with respect to the prevention aspects was the most common, and we know this as well through patient education and also system-based referrals, as well as the home delivery services was also extended during the pandemic. So thank you very much for sharing that with us. I'm now going to move to our next speaker, Dr. Michael Gagno. Dr. Gagno joined the staff at ASHP as Director of Pharmacy Practice and Quality in January of 2018. As a member of the Center on Medication Safety and Quality team, his responsibilities span the practice of pharmacy and include drug shortages, pharmaceutical quality, sterile and non-sterile drug compounding practices, hazardous drug safety, and other practice-related topics. Dr. Gagno earned his PharmD from Rutgers University Ernest Mario School of Pharmacy and his master's degree in Health System Pharmacy Administration from the Ohio State University College of Pharmacy. He completed a PGY1 pharmacy practice residency at the Ohio State University Wexner Medical Center, and he is a board certified sterile compounding pharmacist and was inducted as a fellow of ASHP in 2017. Dr. Gagno has nearly 20 years of hospital and health system experience. His previous job roles have included clinical pharmacy practice, pharmacy informatics and technology, and outpatient oncology pharmacy operations. He has extensive knowledge of drug shortage management, pharmacy informatics and automation, medication billing and reimbursement, sterile compounding, and outpatient infusion and ambulatory care practice models. Dr. Gagno has been invited to speak at several national and international conferences, including several meetings at the National Academy of Medicine on topics related to drug shortages and supply chain challenges. So a very warm welcome to you, where I think your presentation is on hospital pharmacy practice perspective, the role of pharmacists and their teams now and in future pandemics. Thank you so much, Dr. Michael Gagno.
Thank you for the introduction. Thank you to FIP for the invitation, and to the esteemed panelists. These conversations have been excellent so far this morning. Well, for me, it's morning. But I hope to build on some of the themes that Abby discussed and Suzette also mentioned. But we're going to take a little bit of a different approach from the hospital side and talk about the impact of pharmacy practice within the hospitals, outside of the hospitals, and what that means hopefully for the future. So I'm going to focus on a few areas where the hospitals and health systems in the United States got involved with the COVID pandemic. And those bullets are on the slide now. So we're going to talk a little bit about the vaccination process. We'll talk about COVID-19 treatments, how pharmacy operations and hospital operations were impacted. Something that I don't think anyone has mentioned yet, so I'm glad to talk about it briefly: staff well-being and resilience. There's been a lot of talk here in the United States about burnout. And then professional advocacy, how we got to where we are today and how to make sure we are prepared in the future. So the next slide, I'll go into these immunization efforts. So far in the United States, over 250 million doses of the COVID-19 vaccines have been given by pharmacy staff. And this statistic is actually specific to our community pharmacies. This doesn't even include the initial vaccination efforts that were mostly conducted by health systems and public health departments. And the reason that these mass immunization sites were conducted by health systems is because we have the expertise to mobilize large amounts of the vaccine. You think about the cold chain storage requirements, storing in -80-degree freezers. Our community pharmacy networks just would not be able to handle that. So our hospitals and our health systems, along with our public health departments, set up gymnasiums, arenas, convention centers, theaters, any large space that could be used for immunization efforts. And pharmacists took a leadership role in this because of our expertise. If you go to the next slide, we have expertise in cold chain management. We deal with frozen and refrigerated medications all the time. We have supply chain expertise, sourcing medications, sourcing our supplies that we need, needles, syringes, other ancillary supplies. We're used to dealing with medication shortages. We're also experts in surveillance and accountability. And so in storing these vaccines, making sure that those temperatures were monitored constantly. For some sites, we treated the vaccine as a controlled substance because it was so precious, it was so valuable, and we were really concerned about theft or diversion of those vaccine doses. And so those principles for monitoring controlled substances and narcotics apply. In the United States, many states allow pharmacists to administer vaccines. So not only were we experts in the supply of the vaccine, the preparation of the vaccine, but also the administration of the vaccine. And of course, we're the medication experts. That includes medication safety. And I'm glad both of the previous speakers talked about drug information and particularly addressing misinformation. I'll get a little bit more into misinformation in some of the future slides. But this has really become an area where pharmacy can really step up. We are the medication experts, and we can talk about these pieces of misinformation about the vaccine, about COVID-19 treatments, in a way that we can relate to our patients, whether it's through the motivational interviewing that Abby mentioned, or other ways to connect to our patients. So the next slide, we'll talk a little bit about the COVID-19 treatments. As I mentioned, these have begun to roll out with our monoclonal antibodies. We had remdesivir early on, but we also had drugs that were being tried for new indications, things like hydroxychloroquine, things like ivermectin. So the important thing here is this is a new virus, this is a new disease, and so there were not well-established treatments. So if you think about pharmacy's ability to address something that's new, we have this pharmacology knowledge, right? We've all gone to school, we understand mechanisms of drugs, and we understand drug distribution, we understand the impact of these drugs. So while this was a new virus and while new treatments were being tested, pharmacists were well positioned to really understand these treatments and to help make sure our physicians, our nurses, and our patients also understood them. A lot of these drugs are limited supply. There's not they're being developed as we've gone through the pandemic. So we're used to dealing with drugs in limited supply, unfortunately, with medication shortages. So how we manage those is very similar in principle to how we would manage a drug shortage. In the United States, a lot of these have been authorized. They're not fully approved by our Food and Drug Administration. So that means that information is constantly changing. If you think about a drug that's been it's been available for decades, not a lot is changing with that drug as far as what we know about it. Under these emergency use authorizations, sometimes weekly, monthly updates, depending on the different variant that is circulating and what mutations it has, or shelf life stability, how long the drug can be kept on the shelf. Again, we talked about misinformation. So as we learn more about the drug, as we learn more about the virus, we know that some things are no longer true that we once thought were true. And so helping the public understand that is really important. And then, as I mentioned, some of these are limited supply. And how do we ensure that there's equitable access to these drugs among all populations? So the next slide, these are the challenges. Our next slide actually talks about pharmacy expertise in managing each of these challenges. So as I mentioned, we're the medication experts. We talk about the pharmacology of drugs, how they work in the body, how they might work against a particular the virus or in supportive care. So think about the cytokine storm and the use of some of the drugs that have been authorized to help in supportive care in our intensive care units. Again, with drug shortages, we understand how to make sure there's equitable access. So while we're, excuse me, we should be back one slide. Thank you. So with this experience with drug shortages, how do we make sure that patients have access to these drugs? How do we make sure that there's equitable distribution? Misinformation. So we are trained in reviewing literature too. One of the great things out of the pandemic has been preprints, right? So literature is available before peer review, and that's good and that's bad. It's good because it gets information out there quickly, but it's bad because it's incomplete. And so the training that we have as pharmacists to critically evaluate literature, to understand trial design, to understand statistics and outcomes is really beneficial in evaluating how effective some of these treatments have been. So we've learned to approach some of these more critically and hopefully address patients' concerns by understanding legitimate medical information that we've picked up through reviewing literature and through some of these preprint servers. So equitable access, similar to drug shortages, making sure that the drug is available, but think about the positioning of pharmacists, especially in the community. So we're really well positioned for any patient to access us. I think Suzette mentioned the same thing, that we really are in the communities, not necessarily within the hospital setting, but we're positioned in a way that patients can come find us or we can go find them. The next slide, we'll talk a little bit about pharmacy operations within the hospitals and some of the challenges. Again, drug shortages, supply shortages. So not just the drugs, but thinking about the things we need for sterile compounding. So we had a severe shortage of sterile isopropyl alcohol here. It's something that we need to use per United States Pharmacopoeia Chapter 797 in sterile compounding. The same thing with PPE. We had PPE shortages. So gowns, face masks, head covers, shoe covers, these were all being used on the front lines for patient care. Well, we also need them in our sterile compounding environments to protect the sterility of those products. So having expertise in this area helped us deal with some of these challenges. So at the same time, our technicians and our pharmacists are, in many cases, they're inpatient care areas. They're delivering medications. They're going to the bedside and talking to patients. They're with the physicians and the nurse practitioners and the rest of the team as they're conducting rounds. And so we have to make sure that the staff are protected from exposure to the virus. That also means accepting medications back to the pharmacy. So if a medication was dispensed but not used, it could be returned to the pharmacy. What do we do to make sure that that medication is not contaminated? Now we know a little bit more about that, but at the beginning of the pandemic, we didn't understand a lot about how well the virus was transmitted from surfaces. We didn't know how susceptible our staff would be to that kind of contamination. And then in many cases, hospitals increased their capacity. They expanded the number of intensive care unit beds. In some cases, field hospitals were set up. So convention centers were converted to hospitals, all to help with the increase in COVID-19 patients. So the next slide shows just how dire some of the drug shortages became. So here are some common intensive care unit drugs. And the very beginning of the pandemic, ASHP started surveying some of the members about the availability of some of these drugs. And you see how critical the supplies of paralyzing agents like cisatracurium and atracurium, vecuronium, and sedatives like fentanyl, midazolam. These are drugs that we needed in the intensive care units to help ventilated patients. Of course, we had a shortage of ventilators too, and the staff to run those, but this is how critical some of the drug supply became. And you notice the last column, dexamethasone, this was after the recovery trial had determined that dexamethasone was beneficial. We wanted to assess the availability of that medication. And fortunately at the time, it was not widely affected. But the next slide gives you an idea of why we had shortages. So not every drug shortage, the drug shortages usually are not caused by increase in demand. They're typically a disruption in supply. So whether it's from a natural disaster, or some other quality disruption, we don't usually see a drug shortage based on increase in demand. The next slide will show you what happened to the utilization of propofol within New York hospitals. So the blue line is the number of patients receiving propofol. So you see in the first part of the graph, you see the number of doses of propofol in orange matches pretty closely the number of patients receiving propofol. And there's a Monday through Friday pattern here. There's Saturday and Sunday are where you see the two dips. And that's because these are being used for elective surgeries primarily throughout the week and not being used much during the weekend. As the pandemic hit New York, you see the propofol use go way up. It increases, but you see the number of patients receiving propofol come down. This tells you how many patients were on continuous propofol around the clock. This was not necessarily from elective surgery use. And this is what happened in New York. This study also shows similar curves with hydroxychloroquine use, because this is when we thought there might be some efficacy there. It shows ketamine, midazolam, fentanyl. It shows really large spikes in use of these drugs. And that posed a supply chain problem in those hospitals in the area because they couldn't be supplied fast enough. So pharmacy is well positioned to help manage some of these shortages, but at the same time, we have to understand these supply chains for the future, for future preparedness. The next slide touches on something a little bit new, I hope, is pharmacy staff well-being. So clinician burnout throughout the COVID-19 pandemic has been an issue. At least in the United States, we went from being healthcare heroes to being accused of misinformation, to being part of unnecessary lockdowns, masking. And so we went from people cheering as hospitals changed shift, playing music for our nurses, our physicians, our pharmacists as they left the hospital, to being booed, to being publicly harassed. And so that takes a toll. And this is on top of the Great Resignation, which at least in the United States, we've had a lot of burnout in other fields of practice, not just in medicine. But healthcare has been affected more than most other areas. So 1 in 5 physicians had said they plan to exit in 2 years. Healthcare workers are burning out faster than other fields. And it's because we've had extra shifts. We've worked long hours. We've done a lot of these tremendous efforts in response to the pandemic. Our staff have had to be constantly vigilant to prevent spreading the infection inside the hospitals. So there's COVID fatigue. There seems to be wave after wave of different variants. And again, we went from being heroes to being mistrusted and doubted. So what can we do about this? Because it is an important thing. Well, first, we have to understand the problem. So the next slide gives a little bit of insight into how pharmacists were feeling. This is in the United States, surveyed about 4,000 of our members. And the slide's a little bit small, but the main take home is that almost only about 10% felt no symptoms of burnout at all. Fortunately, a small number felt completely burnt out, but this scale shows you that most of our staff, our pharmacy staff, were somewhere on the spectrum of feeling burnout. There's some other notable findings. 33% rated their mental health as good or very good. That means 67% or 2/3 did not rate their health as good or very good. Only 42% were optimistic about the future. The next slide shows the same information, but from our pharmacy technicians. And the technicians are a critical part of our pharmacy practice in the United States. They allow us to do what we need to do to help our patients. Very similar findings among our technicians. We are getting close to time, so I'm going to speed through a couple of slides. There are some resources. The next slide shows some resources available, but think about this in your own countries, in your own staff. What is the state of your pharmacy workforce? And then my last slide talks about professional advocacy. And this is really important. There were some big wins in the United States, particularly around supply chain. We can go forward one more slide, please. Particularly around supply chain, we had new legislation to help us understand where some of our medications come from to make our supply chains a little bit more transparent. We had some flexibilities in sterile compounding guidance from our US Food and Drug Administration in response to some of the shortages of not just drugs, but also personal protective equipment. We've also addressed workforce shortages and equity. So there's federal guidance allowing pharmacists to prescribe some COVID-19 therapeutics. This newly authorized prescribing authority for Paxlovid just came through about 2 weeks ago. And so what it does is it recognizes the role of pharmacists as medication experts, so that the next pandemic or the next emergency, we're available, we're recognized as essential workers, accessible healthcare providers, and hopefully for the next time, we're better prepared and we can utilize the pharmacy workforce. And I'll end there, and I'll look forward to any questions.
Thank you so much, Dr. Gagnon, for your perspective with respect to hospital pharmacy and highlighting the immunization efforts, as well as the COVID-19 treatment as well that the pharmacy teams were involved with within secondary care. And absolutely, pharmacy staff's well-being absolutely paramount. And we've definitely seen burnout across the profession, and we really need to support our profession globally. So thank you so much for that. So our final speaker, last but not least, Mr. Shepherd Msaba. Shepherd is a young pharmacist from Zimbabwe with a keen interest in global health. He has served the International Pharmaceutical Federation Young Pharmacists Group as a subcommittee member and is currently serving FIP as Global Lead for Pharmaceutical Workforce Development Hub. His research on integrating supply chain management practices in community pharmacies and information technology was inspired by the disheartening poor supply chain practices affected in developing countries. This has resulted in significant expired medicines. His research aims to improve access to medicines and also to go a step towards universal health coverage by ensuring effective use of available scarce resources. So I'm actually really interested to hear what you have to say, Shepherd, because I work in a lower middle income country environment as well. So I'm very excited to hear what you have to say, and developing the pharmacy workforce to fight COVID-19 and competency development. So thank you so much, Shepherd.
Thank you so much, Nadia. My name is Shepherd, joining you from Harare. So basically, like what other speakers have mentioned earlier about the COVID-19 pandemic, you all know that the past 2 years have been very difficult for all of us. We experienced so much pain and suffering due to the ravaging COVID-19 pandemic. This has affected the way people communicate, how they work, and even how they study. We saw people using online learning, which was also a disruption from the pandemic. Also, people working from home, and also we also saw the rise of digital communication. We saw people using, I think in my country, we saw people in community pharmacies starting using WhatsApp platforms to communicate with clients as a way of limiting the spread of the COVID-19 due to the self-isolation and the restrictions that were put in place. So in my next slide, I'm going to talk about my work with FIP, where we developed what you call the Global Competence Framework, which is a validated toolwork intended to act as a mapping tool for individuals to progress towards effective and sustained performance and to pave way into advanced practice. So the first version of the Global Competence Framework was developed in 2012. Unfortunately, during the pandemic, we were able to complete the second version. So in my next slide, I'm going to talk about how we developed the global competence and also what it is, just in summary. The Global Competence Framework, it consists of 4 clusters, which were assembled with key competencies for pharmacists. So you see there is the pharmaceutical public health, there's the pharmaceutical care, we have the organization and management, and lastly, we have the professional and personal competence. So the next slide, you just show a graphic of just an infographic of the global competence with the 4 clusters and the behavioral statements that it consists of. Of course, there is some form of interconnectivity between the clusters of the competencies that we have, which will help early career pharmacists in navigating within the profession. So on my next slide, we will talk about the completion of the GBCF in September 2020, where we saw a revision incorporating competencies which were essential to the COVID-19 pandemic. We saw there was an increase in the number of behavioral statements from 100 to 124. And we also introduced 3 new competencies to the global competence framework. On my next slide, we'll also talk about the new competencies which were added. Of importance was we saw the introduction of the emergency response competency. We also introduced the digital literacy competency. And lastly, also there was introduction of the interprofessional collaboration competence. These competencies, as you can see, they were so key for early career pharmacists in terms of navigating the profession during the COVID-19 pandemic. So firstly, I'll talk about the emergency response competence in the next slide, where it was introduced in the pharmaceutical public health cluster to cover competencies related to national and international emergencies and crises. So with the recent COVID-19 pandemic and the ongoing health crisis around the world, pharmacists have demonstrated a pivotal role they have in public health, preparedness, and response, as this has been said by my other colleagues earlier in their presentations. So in the pharmaceutical workforce, which include early career pharmacies, it is important that they have minimum necessary competencies to act in response to crisis. That's why these were so key, because for most early career pharmacists, they didn't know how to respond when the COVID-19 pandemic started. There was so much confusion. People, I mean, so little was even taught at school on how to respond to this pandemic. But with the introduction of the emergency response competence, we saw it being an important skill that will help the early career pharmacists. So in my next slide, we'll look at the behavioral statements on emergency response. So we see that it is important to be able to participate in the response to public health emergencies, and also to assist in the multidisciplinary healthcare teams in emergency situations. The next competence we're going to be talking about the digital literacy competency, which was added in the GBCF version 2. So the use of technology and digital platforms was incorporated in all healthcare facilities globally. We saw social distancing during the COVID, necessitating the use of digital systems in terms of communication and delivery of pharmaceutical services in some instances. This was so important because when people were trying to combat the spread of the COVID-19, there were restriction measures which were put in place, and this then necessitated the use of platforms that can enable people to communicate in the safety of their homes. On my next slide, I'm going to be talking about the behavioral statements that were added in the digital literacy. So this is also a new competence which then was important to have certain, which was important for us to be able to maintain patient privacy and security of digital information related to the patient and workforce. One will also be able to identify, manage, organize, store, and share digital information. It is also important that one would be able to critically appraise, analyze, evaluate, and or interpret digital information and their sources, like Dr. Michael talked about misinformation. I mean, there's so many information which were being put on the internet during the COVID-19 pandemic. Where applicable, one should be able to participate in digital health services that promote health outcomes and engage with digital technologies. That is, either you can talk of the social media platforms or mobile applications to facilitate discussions with the patients and others. On the next slide, we'll look at the last competence, which was added, which is the interprofessional collaboration. This was also key, is said by my other colleague, whereby we saw the collaborative practice within healthcare teams benefiting the patient's outcome. The pharmacists worldwide are expected to work interprofessionally to provide essential medicines expertise. That is been said earlier, whether they providing the expertise in drug information or supply chain management. Furthermore, we also talk about the importance of another competence, which was also of importance to, during the pandemic, which is the leadership and self-regulation. This we see that self-management in a pressured and changing environment, and the ability to adapt to changing situations, and planning and prioritizing and performing tasks well under pressure are a key skill that is required for pharmacists. We saw many pharmacists being involved as frontline health workers, and it was so important in having the leadership skill during the COVID-19 pandemic is pharmacists within the healthcare profession. So in my next slide, we'll also talk about how can the GBSF version 2 be used. So for our national member organization and partners, the GBSF version 2 is designed to be adopted and adapted to registered pharmacists to assist in their career progression. FIP is able to support professional leadership bodies directly with an adoption and adaptation process, and enabling ownership at national levels through the work with the FIP Workforce Transformational Program. More information can also be found on the FIP website. So I think for this whole process on the global competence framework, the revision, I'd like also to give special thanks to my colleagues, that is Asma and Dahlia, for their work, and also the hub leaders. And this whole process of the GBCF went in various stages of validation with internal members and also external stakeholders, which helped in shaping how we would respond to the COVID-19 pandemic. Thank you so much. I'll give it over to you, Nadia.
Thank you so much, Shepherd, for your very interesting presentation. And I agree with you as well. You know, digital literacy is very, very important, and it's definitely one of the solutions towards equity when it comes to access to healthcare. I believe we don't have any questions for our panelists. So what I'd like to do now is actually invite each of our panelists for their sort of a final sentence or final closing remarks sentence. So if we could start please first with Dr. Abby.
Yeah, thank you so much for this great opportunity. I will say I was able to address a briefly question about standardizing pharmacy curricula globally. I'd like to thank my colleague on the FIP quality assurance. We recently developed an education survey that would be administered in the fall, and we look forward to sharing the result with all of you. I also want to encourage everyone to take advantage of the resources that FIP provide, including the competency that we just discussed and additional reports. These are tools available for you to implement, and there's a value for having best practices that are effective on a global level. And lastly, but not least, I want to thank my panel colleagues, because I think we presented a comprehensive approach to dealing with emergency. Please advocate for pharmacists where you are. And this is a great opportunity not to waste the pandemic to advance our profession.
Thank you, Dr. Abby. Dr. Suzette.
All right, thank you for this final opportunity. It was wonderful to share a brief overview of our research study. And by the way, I was requested to, if we had a link for the study. It's published under open access, and I've provided the link both in Q&A and chat. So just a final comment is I think that this pandemic and the involvement of pharmacists all over the world, and certainly the recent developments which have not ended with antigen testing and vaccination, and obviously we're now seeing pharmacists supplying medication in the United States, and that was very recent. So those are important sort of landmarks for the global profession all over the world. And I think that one very important lesson we have learned, and based on the evidence and everything that was published, certainly there is a role and there is an opportunity for pharmacy leaders to grab that opportunity and see if the ways to discuss and further enhance the dialogue with payers, and in what concerns extended powers for accessing medication, such as repeat dispensing, emergency supply, dispensing medication that was previously usually supplied at the hospital setting, such as oncology therapy. I know it's a reality in very few countries, but it's not a reality in community pharmacy in others. And there's certainly a way in improving the access to medication. The other thing is the role for screening and referral with the test and treat, which was certainly the case for antigen testing. We have shown that our pharmacists, they have prevented floods of people into the NHS. And by doing this in the pharmacies, they have helped alleviate the pressure on the healthcare system. So I think there is an important role in there to pursue. And of course, vaccination, which is, Portugal was one of the first countries to vaccinate people in community pharmacies. We have led that back in 2008. And I think we have not succeeded in my country for the COVID-19 vaccination, but we did succeed in other countries. So I think there is a way there for pharmacists to have an enhanced role in future public health emergencies and within the healthcare system as well. Thank you.
Thank you, Dr. Suzette. And Dr. Michael Gagnon.
Yeah, thank you. And Suzette, I'm going to echo a lot of what you just said. I think you said it very well. But with every emergency, with every urgent situation, there's an opportunity, right? And so the one silver lining of COVID, it's been a tragedy worldwide, but it's presented us with opportunities for leadership and for asserting ourselves as medication experts and accessible public health experts as well. And so seizing on those opportunities and looking to the future of, as I mentioned, medication supply chain of understanding essential medications, where they come from, and how we can make sure we have what we need, when we need it, where we need it, making sure that we're a part of public health discussions, vaccination efforts, testing, pushing out treatments to patients, especially in underserved areas and underserved communities. I think have shown ourselves during the pandemic to be these experts and to have this knowledge and the skills and abilities to address these problems. And we need to continue to be at the table as these decisions are happening for future emergencies.
Thank you ever so much. And finally, Shepherd.
Okay, I think something that I noticed at the beginning of the pandemic. I had an opportunity to get the FIP-YPG Professional Innovation Grant, where I was working on digitalization of supply chain management. And fortunately, that's when we also then saw the need of having systems in place for both here in Africa. We usually have manual systems for logistics. Basically, we're looking at forecasting of consumption data, using consumption data. But during the COVID-19 pandemic, we saw many pharmacies willing to have a digital platform that they can use for their supply chain management. And also we have seen more and more people wanting to use digital systems. Is an adaptability for the COVID-19 pandemic. So this pandemic, it has also taught us also to adapt and also how to look towards digital health within the pharmacy profession, which is actually a good thing that we then even thought to have it within the GBC. Have to say, okay, so how can people use digital platforms? What are the issues to do with privacy, confidentiality? How important is it that pharmacists, as they get into the profession, they need to be well versed with digital platforms, whether it's for communication with clients or for their daily use in terms of delivery of pharmaceutical services.
Thank you so much. So that brings our session to a close. I would like to sincerely thank our panelists today. The recording of this episode will be made available on www.events.fip.org. Please do give us your feedback to webinars@fip.org so that we may continue to improve our digital event offerings. Thank you so very much. Have a great day and enjoy your summer. Thank you.